Hey, what's going on, guys? It's Amir Baluch. We're back on the Side Hustle Summit. This episode is going to be how certain wellness tools can supercharge your results as a side hustler. We're lucky to have Dr. Jill Wener here, who is a nationally renowned expert in physician wellness. She's published on several articles on Kevin MD. She's led physician wellness programs around the country. She's lectured at national level on stress and the benefits of meditation and tapping, which we're going to be talking about. She's been interviewed on multiple TV and radio shows as well as podcasts, not just in the medical community, but even beyond. In addition to her CME accredited online and in-person meditation and tapping programs, she also leads meditation retreats all over the world. So Jill, thanks for taking some time out to come on this episode and share your knowledge of meditation to all the side hustlers out there.
Thanks for having me. I'm excited to be here.
Yeah, so your background, you were a physician and then now you transition into this world of wellness and meditation and tapping. How did this come about? Because we don't learn about this in medical school.
We don't. Although oddly some do now, but when I was in med school, we didn't. And I think most importantly, I wasn't open to it when I was in medical school because I was like, meditation stupid. Like I was a very skeptical type A perfectionist medical type. I would never ever would have thought that I'd become a meditator, much less a meditation teacher. So basically my story is that in 2011, I got really burnt out, hit enough of a rock bottom with my burnout that when I heard about this meditation course, that a friend told me about, I just thought, you know what, why not? Let me just go try it. And I went to go hear the teacher speak and everything he said just kind of resonated from a personal perspective, but also like medical physiology. I was like, okay, this all makes sense. This doesn't sound like quackery. So I signed up and it was amazing. And honestly, for me, I know this isn't the case for everybody, but for me, the meditation really fixed my burnout. It gave me the capacity to deal with the things in my job that I have found stressful. And I practiced medicine happily for another 4 years or so. During those 4 years, I thought I wanted to become a meditation teacher in this tradition, which is a 3-month training in India. So I always thought, okay, I'll go do the training and then I'll come back and be a hospitalist part-time and teach meditation. I'll still live in Chicago. I never even considered that I would leave medicine because I was happy enough. It was fine. And then I had the opportunity before I went to India, and my boss was actually supportive. I had the opportunity to move overseas even before I went to India. And so I ended up leaving my job for that, never ever thinking I'm done with medicine. But after being out of medicine for about 6 months and then having this new tool, which was being able to teach meditation, something that I was really passionate about, I just felt like going back to medicine wasn't the right choice for me. And I was really excited about teaching the world to meditate. So I was very, bright-eyed and bushy-tailed. And that's kind of how I started off unintentionally moving away from medicine.
Got it. And I was kind of like you when you were in medical school. I wasn't really into meditation. I've actually have never meditated. The closest thing I think I got to was I tried a couple of yoga sessions to increase my flexibility, and I realized I'm really not flexible, and I kind of felt embarrassed that I couldn't do any of the positions. But I'm very interested in this because I've learned there are a lot of top performers out there. This is just a routine part of their day. I don't even know what even types of meditation are there. Can you explain to some people the different types?
Sure, absolutely. So I think and first off, I just want to honor and name the experience you had in a yoga class. And also my partner, he's been practicing yoga for 15 years and he loves it and he's still super inflexible, and that's just the way his body works.
Got it.
And in a nice yoga setting, that's okay. There's nothing wrong with not being flexible. I can't do arm balances, and that's just the way my body's made too. So anyway,
I don't feel as bad now.
Yeah. You tried. And I don't teach yoga, but I didn't like yoga the first few times I tried it. There's some thing that gets kicked on after the first few tries. Anyway, most meditation, including stuff that you're going to access in a yoga class, is generally going to be some sort of mindfulness where you're focusing on something, you're concentrating on your breath or on your thoughts or on different sensations in your body, or maybe on a mantra. And you're sort of taught to like cultivating focus and attention and present mindedness. That's great. I love it. Mindfulness is wonderful. It's also very challenging for people to do. And a lot of people feel like they're banging their head against the wall because their minds are going crazy. And the more they try to like steer their mind in one direction, or they think they have to try to clear their mind of thoughts, the busier their mind tends to get. And so they might give up. They might say, you know what, I'm just not cut out for this. It's for other types of people. My mind's too wild or too broken for this. The type of meditation, so that's mindfulness. And that's going to include most stuff that you see on apps like Headspace and Calm and all of those. And again, I don't have any problem with any type of meditation. I think they're all great. It's just finding what works for you. So the type of meditation that I teach, I call it conscious health meditation. It's from the same tradition as Vedic meditation. And it is kind of 180 degrees opposite from mindfulness. In that we actually get to sit comfortably. We sit with our back supported. If you have an itch, you scratch it. We're happy to have thoughts. We welcome thoughts. We're not just tolerating them, but we're happy to have thoughts. The thought being, our mind is built to have thoughts. That's what it does all day, every day. If we try to fight against that, it's like trying to tell the heart to stop beating. It's that natural for our brain to have thoughts. So rather than swimming against stream, this technique allows us to swim with our thoughts. And in the technique, it actually allows our body to get to a unique physiologic state that kind of slows our metabolism down. Heart rate drops, respiratory rate drops, lots of other physiologic variables change. This has actually been tested. And that allows us to activate the parasympathetic nervous system and get a profound amount of rest for our body, which then allows us to perform better. I mean, this technique this is an ancient Indian technique. So it was not invented for high performing. It wasn't invented to manage stress. It was invented for, developed or whatever for other reasons. But I think it resonates so much for people in today's society, because the benefits that it brings, in addition to managing stress, helps us kind of function in the world in a different way, and in a lot of ways, a more effective way.
Got it. We answered some of what I was going to ask next, because I'm sure there are doctors out there thinking, why do I need to listen to this? Why do I need to learn about meditation? Like, if the system is stressing me out, why I need to change? We need to change the system. We need to group together and change healthcare, which I don't know if we have enough power to do that or not. I mean, we've been trying for a long time. So right. What would you say are like maybe the top 3 benefits people can get from this? I'm thinking just in this brief conversation I have with you, just getting a deeper rest state. I mean, I know if I get good rest, the next day I'm like on fire when it's time to get a lot of work done. So what do you think would be the top 3 things that people could get out of this?
That's a great question. I first want to just honor what you said, because it absolutely it's yes and. The system needs to be fixed. The question is, how do we fix it? When is it going to be fixed? What does it look like when it's fixed? Do we agree on that? There's so many, it's such a gigantic behemoth of dysfunction. And we are human beings trying to survive in it. And we're trying to live our lives and not just survive, but possibly enjoy ourselves and have a good quality of life. And so what I love about the practice is it sort of helps us show up for ourselves and our patients. If you're practicing medicine still, or for your family, it helps us show up for ourselves so that we enjoy the life that we're living as we try to navigate the dysfunctional healthcare system. So it's just, building resilience is not the only answer. Yet it's so much nicer to go through to navigate a broken system when you do have resilience, because things just don't feel as heavy. It's a lot easier to adapt to change. I remember sitting in our weekly hospitalist meetings and all the stuff that I used to get so mad about, like the different metrics and the different, patient satisfaction and all the student resident reviews, all that kind of stuff. It just, our bonus structure, like it just felt less intensely troublesome for me. It was easier for me to kind of go with the flow. Not in a like toxic avoid negativity kind of way, but in a like big picture, these small things are small blips along a much bigger path. So I think that's one reason, is just to make your experience of life feel better. Another thing is it really does help with efficiency. So I practice 20 minutes twice a day. The course I teach is 15 to 20 minutes twice a day. And it's not the kind of thing with some mindfulness practice where you kind of have to work up to it and it's like 3 minutes feels like torture. By the second day of the class, you're meditating 20 minutes twice a day, and it's actually really easy to do. So you feel like maybe I'm just giving away my time. Why would I spend 40 minutes of my time when I can barely, manage my kids and my work and all these other things and my side hustle and my doctor job. But what you get that time back and then some. So if you can imagine when you're doing, what kind of medicine do you practice? I don't actually know.
Well, anesthesia, and I've got like 5 different side hustles too. So
okay.
Nonstop. Actually, what you said, you're basically describing me. Like if somebody said, hey, meditate for 20 minutes, I'm like, I don't even have 5 minutes. What are you talking about?
Right. So imagine like, it's like towards the end of your shift, and you're trying to get all your documentation done, or you're looking up your patients for the next day, and you're bleary eyed and you're just like, oh my God. And you're just exhausted and your brain isn't functioning right. A lot of times people will go grab coffee at that point. If you do a 15, 20-minute meditation, it refreshes your brain and it gives you much more clarity of thought, and you can get things done much more efficiently. So you get that time back that you devote to it, but it does take a consistent habit, a consistent practice. So you get more efficient. And I remember being really, really surprised by how much more efficient I got when I started meditating. Also just in general, thinking about all the time we spend on social media, the number of times we hit snooze. We do have the time. One of my meditation colleagues says, if you can't find time to meditate in your day, you're spending your time on the wrong things, which I think is hilarious, but also like a kind of, it's hilarious and it's ridiculous. And it's also a little bit true. But if we want to be feeling better and our life doesn't allow us to feel better, there's usually a way that we can like fit it in so that we can have everything that we want.
Yeah, I think people just need to would have to just make it higher priority. Like, okay, turn off the Instagram and the Facebook for a little bit and put in 20 minutes into this.
Exactly. And part of the instruction I give is it's not just the techniques. I'm actually teaching people to be a self-sufficient meditator. Part of the instruction is how do you fit it into your day? And how do you set yourself up for success and forming new habits and all of that? Because that's the hardest part. It's not the meditating itself. This type of practice is actually really lovely and really easy. But we got caught up in our heads and telling ourselves that we can or shouldn't have the time to do things that make us feel better. And I'd say the third thing is creativity and problem solving. So when we're in that restful state, our brains are much more relaxed, and that wall of stress that's around us all the time, we kind of let that down, and we have a lot more access to our own creative intelligence, and we'll get aha moments. And even within the practice of medicine, like this realizations about a patient's diagnosis. One of my students is a chair of medicine, and she loves it because it helps her make it like solve administrative issues where she's working through to different issues for her department. So it helps people become a lot more creative, and it really helps with like creative problem solving. And I'm going to give you a fourth thing, which is that it accesses our intuition better. So that negative voice inside the head that's like, you suck, like this, you're too busy for this, you can't do a fifth side hustle, you're a doctor, what do doctors have any business, starting something different, whatever those, you're too old for this, whatever that voice is, it's really loud, and we sometimes don't recognize that it doesn't have our best interests at heart. So the meditation helps us tap into our intuition more so that we can like stand a fighting chance against that negative inner critic. Because if we don't do something to lean into what we really want to do, and that fear, that like little gleam of excitement, like, ooh, it seems kind of scary, but I want to do it. And then we immediately talk ourselves out of it. So it helps with that as well.
Well, let me tell you, all those points are awesome. Like, I'm in the operating room all the time, and there's a lot of things that happen, like cancellations, delays, and it's so easy to let this get to you, and it can almost ruin your day. But if you're just calm about it and know how to deal with it, you definitely have a more pleasant day. And when you talk about with the efficiency, I mean, what side hustler doesn't want some efficiency already? Like, I mean, I've got a lot of questions I'm going to ask you about myself after this, just because you mentioned that. I got, a lot of ideas how I could incorporate this into my own life. You also mentioned certain routines. So for me, I just think meditation is you sit in a quiet room and you just kind of think or something like that. But you're saying there are these different types of routines. What type of routines are there? And are there any that you would recommend to doctors in particular?
So the meditation technique that I teach, either the online course called the rest technique or conscious health meditation, which is the course that I teach live, that I teach on my retreats. They're both practiced twice a day. And whatever type of meditation you practice, it's always good to kind of fit it into your day at a regular, like in some sort of routine way. What I recommend is meditating first thing in the morning. So you have to get up a little earlier, but it's something that's much more restful than those extra 15 to 20 minutes of sleep. So it's more beneficial. You do your meditation and then you go about your day, and then you meditate towards towards the end of the workday. So mid to late afternoon, early evening. And a lot of people work shifts and overnights. And so part of my job is to help people fit it into their lives. So that's meditation is it's a daily practice, and you're going to get the most benefit. Any meditation is better than none, but the twice a day is really when it lights your life on fire in a good way. The tapping that I teach, that's also called EFT, or the emotional freedom technique. That's another really awesome modality that can help with productivity, and great for side hustle folks, because in a lot of ways, but that one is practiced less of a routine. So people can benefit from that if they try it once, if they do it once a month, if they do it once a year. There's not like a learning curve for it. And it's not the kind of thing where you have to practice it regularly to get benefits. So that's that I use PRN. If I'm in a bad place, or I'm feeling like angry at something that happened or frustrated, I can tap right there for 5 or 10 minutes and feel a lot better. So the two work really well together. So in terms of routines, I think it depends on what you want or what you're looking for. I think of the meditation more as preventative. It does calm you down when you do it, but it also kind of prevents you from getting to that heightened state where you want to scream and throw things. And then when that's not quite enough, then the tapping is really great.
Okay. You were mentioning this retreat. Can you tell us more about these wellness retreats? And I think some people can even get CME credits for this too, right?
That is true. Yes. So the retreats I do at this point are for women in healthcare. So doctors or anybody else who is involved in healthcare. I do it at this beautiful spa in Arizona called Miraval, which is my happy place. And so I get to go there now for work, which is great. And it's really
tax deductible too, then, right? Because
exactly, credits, so. Exactly. No, it is like, that's the whole thing. It's beautiful. And oddly, just for anyone interested, I found out after my first retreat, I pay them on my credit card. So I get all those credit card points, and then I also get Hyatt points for it. So if you're thinking about planning events as a side hustle, there's really cool things like benefits that you may not realize. But so that's not why I did it, but it was a nice little bonus. So I do this event, the venue itself, you leave Miraval feeling amazing. And if you take my meditation course, you leave that feeling amazing. But combining the two of them together, it's this exponential experience, and you get to leave the spa and bring some of it with you, because you know this meditation practice. I also do a tapping workshop on my retreat. So people also learn tapping, and they get to take these techniques with them. So my next one's in March 1st through 5th. And I'll do another one mid-October.
Very cool. Well, we're definitely going to have some links to that for the audience. If you guys want to learn more about this retreat or learn more about Jill, just check the links below this video and also check your email, because for all the speakers, we're going to have email links to resources that they have to make you a better side hustler. Usually, Jill, I like to end these things with some action steps that people can take, because I don't want people to just go through a course or video podcast and then no action is taken, because then it's like, I hate wasting time on type A personality. So what are some action steps? If you could just lay it out for somebody, 1 to 3 action steps, what should they do next if they're interested in meditation and decreasing stress and becoming more efficient? What can they do?
I think the first thing is mindset, and approach your wellness and your well-being like you're approaching a business, and that you will do whatever it takes to get yourself where you want to be, and open to trying new things. I think a lot of healthcare people, including me, are kind of groomed to not be open to some types of these practices. Everything I teach is actually evidence-based, but experientially they feel amazing. So just if something comes up and you're like, that sounds kind of interesting, try it. That would be my first advice. Other things that people can do in terms of my offerings, I have a free app-free anxiety challenge on my website, which is 5 free days of different guided tapping meditations, which is the other modality that I practice and teach. So they can check out more about that. And then another option, if you're interested in learning to meditate and you are like, let me just try it, let's just see. I did mention I have an online course, and that's CME accredited. And you can just go, and I think the link for that will be also in the email, and just check it out, try it out, get some CME, and give yourself the chance to do something, like just take that first step and let yourself, treat yourself to this experience, because it can be very life-changing. Very
cool. Guys, easy steps, clicking on a button and just signing up for these 5-day challenges and these courses. It's all laid out. There's not too much thinking involved here, guys. Like, imagine you just be 5 or 10% more efficient every day, what you can accomplish, and you're feeling better. It's good for your health. To me, this is a no-brainer. So Jill, I'm very happy you shared all this with everybody, including me, because this is all new to me. So that's why we're going to have a separate conversation after this. So that's very cool. I mean, thanks for having us on here and dropping knowledge on everybody that's listening today.
Thanks for having me. It's a lot of fun.